Welcome to another Vital Nursing video. In this video, you will get to test your nursing critical thinking skills by answering one question. Can you get it correct? Before we start, subscribe for more videos like this to help you pass nursing school. We want to help nursing students succeed and become well-equipped nurses once they're in the field. Videos are uploaded frequently, covering multiple nursing topics. Okay, let's begin. A measurable outcome criterion in the nursing care of an adolescent with anorexia nervosa would be accepting her present body image, verbalizing realistic feelings about her body, having an improved perception of her body image, exhibiting increased self-esteem. If we remember, anorexia nervosa is an illness of starvation, brought on by severe disturbance of body image and a morbid fear of obesity. People with anorexia nervosa attempt to maintain a weight that's far below normal for their age and height. To prevent weight gain or to continue losing weight, people with anorexia nervosa may starve themselves or exercise excessively. Let's go over the answers. Answer A is incorrect because the term accepts is not directly measurable. Answer C is incorrect because improved perception of body image is not directly measurable and is therefore open to many interpretations. Answer D is incorrect because although long-term goals for the anorexic client should focus on increased self-esteem, this outcome criterion, as stated, does not include specific indicators or behaviors for which to observe. This then leaves us with the final answer, B, to be correct, which is verbalizing realistic feelings about her body. This outcome criterion is directly measurable because specific goal-related verbalizations can be heard and verified by the nurse. Okay, so how did you do? Leave a comment below saying whether you got the answer right or wrong. Thank you for watching, and remember, we post videos weekly, so check in often.